You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's a hot topic. Lots of people, millions of people have COPD and symptoms associated with COPD. And my first guest is an expert on the topic. He is a board-certified pulmonologist talking about how your diet can affect and possibly even reverse some of the symptoms of COPD. With us, we have Dr. Cedric Rutland. Dr. Rutland, welcome to the program.
Thanks for having me again. Appreciate that.
Now, first off, just to identify what COPD is for people just tuning in, what is it?
So again, what COPD is, what it stands for is chronic obstructive pulmonary disease. Now, when we think about chronic obstruction, what we're talking about is when we take that breath in, when we breathe out. As we breathe out, we may wheeze, and we call that an obstruction. And we quantify that obstruction, and we will define how severe your obstruction is. That's what COPD is. It encompasses many illnesses, the most common ones being generalized COPD, asthma, and amongst other illnesses that aren't as common, but generally speaking, run-of-the-mill COPD and asthma.
Now, for people that don't know your practice, who's a typical patient?
So my typical patient encompasses a variety of different people. Generally speaking, the average age is in the 50 to 60 range. They generally come to me with shortness of breath. Usually I've seen them in the hospital. Sometimes they're referred to me from primary care physicians. And the first complaint and the most frequent complaint is shortness of breath and cough.
Okay, now you said you see them in the hospital. So you work in the hospital, your office is in the hospital?
I do, I work in the hospital. I cover several different hospitals in a certain area of the country. And when I'm in those hospitals, what I can do is when I see the patient that comes in with shortness of breath or acute illnesses, they'll end up following with me as an outpatient, and I'll see them in the office.
Okay, so when they see you, is it they've ruled out that it's heart disease?
Pretty much, yeah. But generally,
then they see you.
Right, and generally speaking, the cardiologist is the one, they'll see them first, and they'll say, it's not heart disease, go to the pulmonologist. And typically that pulmonologist is me or one of my partners.
Okay, good. Now, let's talk about diet. Now, you know a thing or two about diet.
I do know a little bit about diet.
This is part of your lifestyle. So before you give your tips for people with COPD and what they should be eating, what do you eat?
So again, about 2 years ago, I got really into weightlifting and eating right. Honestly, because I like to look good with my shirt off. That's the true.
You measure your food, you said.
I measure my food every day.
Every day?
My wife and I measure our food. In the mornings, I'll tell you right now, here's my breakfast. This is what I have for breakfast, okay? On a typical workout day. I get up 5 o'clock in the morning. I have 55 grams of Quaker oatmeal.
All right.
I have 60 calories of fruit. Now, it depends on which fruit I'm eating that day to see how much I can have. If it's blueberries, it's 55 grams. If it's pineapple, it's 120 grams. It depends on the fruit. Then I have 40 grams of protein with almond milk and water. I don't do dairy that much, but I have 40 grams of protein with almond milk and water.
Like a whey protein?
So it's a true teen protein, but yeah, it's about 80% whey.
Okay.
But yeah, it's a whey protein. And then I will have, after that, so I have my fruit, I have my oatmeal, I have my protein, and then right now, because I'm in a bulking phase, I have 20 grams of natural peanut butter.
Okay, and then you go to the gym.
And I go to the gym, and I come home, and then I have carbs. I can have 280 calories. I can't exceed 280 calories. Generally speaking, I'll have 5 Quaker oatmeal caramel rice cakes, which are delicious after the gym, by the way. And then I'll have another 40 grams of protein, and then off to work.
All right.
For lunch, I have 110 grams of chicken.
Which is 5 ounces?
About 5 ounces or so.
Okay.
I have 180 grams of white rice. And then I have a cup of vegetables. And we're talking greeny leafy vegetables. We're talking carrots, whatever vegetables.
And you weigh your food every day. But don't you know by now what 5 ounces of chicken?
I do. So if I forget, I can eyeball it and I can look at the hospital menu.
But you try to weigh it every day.
I try to weigh it every day. Yeah.
And then dinner?
Dinner is very similar to lunch. So that was my first lunch. I have another meal about 3 to 4 hours later where I get a little bit of carb in this meal. I'll have 3 corn tortillas, each will be 50 calories. I have another 110 grams of chicken, and I have 100 grams of brown rice and another cup of vegetables. And then for dinner, I get 110 grams of steak and about 30 grams.
And this is about 5 ounces again.
Right, about 5 ounces again, and about 30 grams of almonds.
All right, and that's like less than, because petite fillets are 8 ounces.
Usually, yeah.
So it'd be like cutting off a little bit of the steak.
Like 25% of that. That's about what I 25% off of that 8 ounces is about what I eat for dinner.
And your workouts are pretty, I mean, you're an active guy, you like an hour workout?
Four days a week, and they're about an hour and 10, an hour and 20 minutes right now while I'm bulking. When I'm starting in slim down again for like a show or something like that, then I ramp up the cardio and I'll do some things on Saturday and Sundays where I'm doing more running and such.
Okay, good. Now, okay, so let's talk then. Okay, so somebody has COPD. Now, this crowd of people, they know they have COPD? A lot of them, they've been told, they've been diagnosed?
So they have been diagnosed. Usually the diagnosis is by me or one of my partners or in the hospital. And then they come see me and then we talk about therapies. Now, everybody that comes to the office, they want a medicine. They want something that's gonna help them get rid of the shortness of breath. The best medicine, as we've discussed before, is to quit smoking the cigarette.
Okay.
I think the second best medicine is a well-balanced diet. Inhalers work, okay? Certain inhalers work, they make you feel better. But the well-balanced diet is what leads to a reduced amount of inflammation within that lung. And it's amazing when you think about it and you look at it on a microscopic and molecular level, when you look at the enzymes that are involved in inflammation, you can really help those enzymes and help your body get rid of some of those, what we call reactive oxygen species that cause inflammation. You can get rid of those if you just simply modify your diet. And this has been studied over and over and over again.
I have a lot of some not so mainstream functional medicine doctors, anti-aging medicine doctors, and I consider you a mainstream doctor, like a real doctor, right? But you know, we're always told that you don't have much time to spend with a patient to talk about diet and exercise and nutrition. Isn't that true? I mean, you only have a certain...
I think it's true to a certain extent.
Like 10 minutes, 15 minutes?
15 minutes, 10, 15 minutes. But here's my approach when a patient comes in. Now, some of the patients that come in, they'll have COPD. I had a patient come in, first name was Sherry. She came in about 3 or 4 weeks ago. She was a little bit on the heavier side. She was classified as obese according to BMI. And so what we discussed for about 7 minutes during her visit, which you don't think is a long time, but during a doctor visit, when it's just you and a patient in the room, that's a long time. We discussed diet. So first, quit smoking cigarettes, right? She knows that, she wants to do that, she wants to quit the cigarettes. But then we started to discuss diet. Now the way that I introduce diet into their life is I tell them about my diet, and I talk to them, and I look at them and say, listen, Cherry, this is what we're gonna do for you. What I want you to do, I don't care how many times a day you eat, I want half your plate to be fruits and vegetables. That's just how we start. I just want half your plate to be fruits and vegetables.
Okay.
During that visit, I'll convince them to buy a scale as well. And I'm not only talking to them about their lung disease, I'm talking about their overall health, because that's what's important. And I want them to feel better. And I know that the lifestyle that they're leading at that particular point in time is not one that would lead to a reduced amount of inflammation in your body. They're eating whatever they want. They're not eating enough colored things like fruits and vegetables, and that's what they need. And so I supplement that, and I'll start seeing them frequently.
So 50% fruits and vegetables. What about the other 50%?
I say whatever you want, put it on that plate. We start with that.
Protein?
Yeah, I say, so generally speaking, I'll say 50% fruits and vegetables, a quarter of your plate, I want chicken, I want fish, I don't mind the steak, and then the other quarter of your plate, I'll have the carbohydrate. I'd like to stay away from the mashed potatoes with the garlic and the butter.
So no starchy carbs?
No starchy carbs. I'm okay with brown rice. There's another protein that I really like that's very similar to starch called quinoa that I've eaten before that I try to convince people to eat, and if they season it correctly, they can tolerate it.
Okay. Now, have you ever had people that come in, they're very stubborn, right? You know, COPD, maybe they watch the Dr. Oz show, they probably watch my show, I'm kidding. But they say, I mean, have you ever seen a relief of symptoms with just diet? Like somebody, like it's a wake-up call with COPD, and now they eat differently and their symptoms go away.
So, the question is, when they come in and they're smoking, and they quit smoking and they do this diet, I can't say whether it's the smoking or it's the diet. What I can say is there's actually a study done several years ago, and the study showed it was smokers, non-smokers, and diet. And even the smokers that changed their diet had less wheezing, had higher lung function tests. And so I do think that diet can alter your symptoms, but I also think the biggest thing that's gonna alter your system the most is gonna be the quitting smoking.
Okay, so quitting smoking. So they quit the smoking, and you haven't, so eating lean proteins, lots of fruits and vegetables, and they all know that they have to do that.
They do.
Right? I mean, most people know, right? But they just can't get themselves to do it.
Right.
So is COPD sometimes a wake-up call?
It's a wake-up call. And the other thing that's a wake-up call is once you get somebody to do it, and you have to see these patients frequently. And yeah, it's gonna clog up your clinic and everything like that, but that's okay. Because these are the people that you can actually help. If you can actually get them to say okay, and you get them to keep a food diary, then those are the ones that are gonna come in the next time. They're gonna have more energy. They're gonna have less wheezing. They're gonna have lots of those symptoms that you don't want them to have. They're not gonna have those symptoms anymore, so they're gonna feel better. And that just means they're gonna come back and see me more because they want to hear what I have to say.
Have you ever had anybody get off inhalers?
You know, I have had people get off inhalers, but again, I can't say whether it's the smoking or whether it's the diet, but I know the diet contributes to it. And these are the 40-year-old guys, right, that come in and they're relatively in shape and they care about sports. They watch the NBA, they watch the NFL, they know they need to quit smoking. I get them to quit smoking. I get them to change their diet. Their wife is in the room with me, and their wife tells me at the next visit, he's so much better, he's out doing more things, he stopped using his inhaler as much. So I think it has an effect.
Now, if you ate like your patients for a week, you'd feel terrible.
Awful.
Is that right?
Awful. I would feel awful. And I've done that. I mean, who doesn't go on vacation? When I go on vacation,
you eat like your patients.
Like that. My wife's from Kansas City. I went to Kansas City in May for 10 days, and I wasn't able to measure my food as much because they don't have a scale. In my wife's family, They don't have a scale in the kitchen. So I had to eyeball things. But again, what do you do when you're on vacation? You go out to dinner and lunch with your friends. So all we had barbecue, and Kansas City's famous for barbecue, and that's what I ate. And I'll tell you, I felt terrible.
Okay, now you printed out something. What you wanted to talk about something?
I did.
As far as diet.
So again, a lot of times patients will come in and they just don't know what to eat. They look at you dead in the face and they say, well, what foods can I eat? So when we talk about vitamins, we're talking about vitamin A, vitamin C, vitamin E. Those are the vitamins that are considered antioxidants. What do I mean by antioxidants? Here's what happens. So in your lung has mucus tissue. You take that breath in, your air is basically touching your lung tissue, okay? When you smoke a cigarette, if you have smoke in that air, it irritates that tissue. When that tissue gets irritated, these are cells. These are little machines in your body. When that smoke irritates that cell, it creates a cascade of inflammatory events. What the antioxidants do is they help calm down that cascade of events. And scientifically, you can see it. I can write it out on a piece of paper. And so those are the vitamins that help you the most. But again, patients say, well, what do I take? What vitamins? So we're talking about vitamin A, right? So vitamin A is one of those antioxidants. So what foods have vitamin A?
Yeah.
Anything that's orange, okay? So orange has vitamin A, carrots have vitamin A, bell peppers have vitamin A. Lots of other little sneaky foods on here will have vitamin A. Sweet potatoes, dark leafy vegetables will have vitamin A. And I don't care how much you eat them 2-3 times a day.
Okay.
The more servings, the better. Another vitamin, vitamin E, another antioxidant, all right? It's the same kind of thing. What foods can I eat that have vitamin E? Well, let's take a look. It's really easy to find out. Leafy greens, almonds that I eat every night have vitamin E. Sunflower seeds, avocado has vitamin E. And then the most famous vitamin, right? Vitamin C. Everybody talks about vitamin C, immune health. And it's true. It calms down that inflammation within your lungs and really within the body. All right. And vitamin C, we all know these foods. Oranges have a lot of vitamin C. All right. Other things that have vitamin C, kiwi fruit, broccoli, all those citrus fruits, mango, they have vitamin C. And so again, when you're walking in the store, that produce aisle is normally on the left, walk to the left. Go grab that produce. Go grab those vegetables. Those are the things that are going to make you feel so much better.
So people with COPD, they eat things like this, and it what? Like opens up the airway more?
Right, exactly. So
they breathe better?
Right. So there's a molecule within your lung, all right? And the name of the molecule is called a reactive oxygen species. Doesn't matter what the name is, okay? What it is it's bad news, all right? It creates inflammation in your lung. Remember we were talking about COPD and obstruction. Obstruction is inflammation, that tube narrows, okay? When that tube narrows, usually there's something that causes that narrowing. The reactive oxygen species can cause that narrowing. So it's a molecule. What the vitamins do is they simply take up that molecule. Once they're in your system, they take up the molecule's no longer there. And we've actually seen better lung function with eating these foods that have these vitamins present within them.
Okay, now you haven't mentioned bread at all.
I haven't.
So get rid of bread?
I don't say get rid of it.
Do you eat bread?
I do eat bread. Well, I take that back.
Like
My wife eats bread. She eats 45-calorie slice of bread.
You take that back. Your wife eats bread, but you don't eat bread.
I don't eat bread, not that much.
Well, then your patient shouldn't eat bread. I mean, is that too much to ask? Is that why you react that way?
I think so, yeah. So I try
But ideally, what if they come in and they listen to everything you said? You would get them off bread.
I would get them off bread.
Okay.
I would do brown rice. I would do white rice. I would get them off bread.
Like sweet potatoes, things like that.
Sweet potatoes.
Okay. I mean, because it's better to come on the show and just say, you know, even though, like you say, but somebody might take your advice and it could save their life.
It could.
So get off the bread, which has gluten, which has a bunch of other problems.
I had a guy come to my clinic 2 years ago. He had interstitial lung disease, which is inflammation of the lung. It can also lead to obstructive lung disease. He was 350 pounds when I first met him. We talked. We spent a lot of time talking about diet. He had very severe lung disease. He was on 8 liters of oxygen. Normally, we're on 0 right now. We put him on Nutrisystem, diet, vegetables. In addition to the typical therapies of his lung disease, the guy lost 180 pounds over the course of about a year and a half. He was off his oxygen by the time I saw him last in my office, which was 2 years ago when I was practicing in Kansas, and he felt so much better. And this is just with diet. I put him on the same therapies that I put everybody else on. The only thing with him was he was very compliant with his diet, and he decided he wanted to make a change. He was 62 years old. And his lung disease completely changed. All of the inflammation within his lung calmed down. Did it go away? No. But did it calm down? Yes.
Are you seeing this with emphysema as well? Because you see a lot of patients with emphysema.
Yeah, you can see it with emphysema. Now, emphysema, again, is just dead lung. If you can imagine your lung
slowly dying
as a bunch of balloons sitting on top of one another. If those balloons pop, that's emphysema. I can't change that. What leads to the emphysema is that inflammation. That's what leads to the emphysema and the destruction of that balloon. So if I can get you to change your diet, in addition to quitting smoking, yeah, you're gonna have less inflammation. In the long run, yes, you will have less emphysema.
Is that right?
That's true.
Okay, final message about diet and people with COPD.
So the final message, I think, from my perspective, is we as physicians need to start looking at food as medicine. And I mean vegetables, fruits, things of that sort, because that is only going to aid in helping the patient feel better. That's the goal.
Okay.
When somebody comes to your clinic office, when somebody comes to my clinic office, I want them to feel better. I don't want them to come next time and feel worse. I want them to feel better. And whatever I can provide them, which is basically information on what foods to eat that will help them feel better, in addition to the medical therapies I give them, is going to keep them coming back. And it's going to make them lead a healthier lifestyle.
Now, you take PPO or HMO insurance?
Yes.
Both?
Both.
And if somebody sees you on YouTube or if somebody sees you on my show, they could actually ask for a referral to see you?
They could.
They could go in there and
They
see
can
you?
ask for a
Because you
referral to
become
me.
like the new hot sensation pulmonologist across the country right
I
now.
wouldn't say hot sensation.
You're the most famous pulmonologist I know.
No, yeah.
Right?
not at
Well, it's
all.
true. I tell people, I said, this guy is the one to watch. Well, good for you. Okay. All right. Thanks again for coming on the show.
Thanks a lot for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.